Hi, I'm Prateek, and in this video we're going to learn a little bit more about a really common viral illness called Herpangina. Remember, if you want thorough revision notes, exam cheat sheets, CPD, along with a huge bank of exam-style questions and guidelines, head over to ExamineDental.com. We also have expert one-to-one mentoring sessions in order to help you ace those interviews and exams. Herpangina is an acute viral illness. It predominantly affects children and is a self-limiting condition. Herpangina is characterized by sudden onset fever, sore throat, and painful vesicular lesions within the oropharynx. It classically affects children, usually between the ages of 3 and 10, so often we'll see outbreaks within nurseries and schools. Herpangina is predominantly caused by the Coxsackie virus A. In particular, the A4 strain is commonly found. Other strains of Coxsackie virus A are also associated with Herpangina. Occasionally, infections can also occur because of Coxsackie virus B and other enteroviruses. Transmission of this condition can occur through respiratory droplet spread, fecal-oral spread, or direct contact with a contaminated surface. This is a condition that can spread very easily from child to child, hence seeing outbreaks. There is a very classic oral presentation of Herpangina. Patients will initially develop small vesicles on the soft palate, the tonsillar pillars, the uvula, and the posterior oropharynx. These vesicles then gradually rupture in order to leave behind shallow ulcers with an erythematous halo. Other systemic symptoms, as mentioned, include pyrexia and pharyngitis. You might also find that children tend to drool when they have this condition because they're not comfortable swallowing their saliva. However, this condition is self-limiting and symptoms usually last 3 to 7 days. Herpangina does not require any special investigations or tests in order to diagnose it. Diagnosis is done through the classic presentation and the history that the patient presents with. It can appear very similar to other conditions such as hand, foot and mouth disease, herpetic stomatitis and general aphthous ulceration. As this is a self-limiting condition, management is all about supportive care. You should advise patients to take antipyretics such as paracetamol in order to help control their fever. They should also be encouraged to stay as hydrated as possible, particularly if the patient isn't consuming much food and drink normally. Patients can also be advised to use topical analgesics or anesthetics such as a lidocaine spray, and they can be encouraged to have a soft or a bland diet as this will be most comfortable for them, particularly with ulceration. As this condition is incredibly infectious and can easily be transmitted, any contaminated surfaces should also be disinfected. Ideally, patients should not be sharing any utensils with another individual. So in this video, we've looked at the common viral condition Herpangina. We've looked at the etiology, which includes the Coxsackie virus A. We've also looked at how to diagnose and how to manage Herpangina as a condition. We've also looked at the classic clinical presentation with vesicles and ulcers, as well as how to diagnose and manage this self-limiting condition. Remember to head over to ExamineDental.com, where you will find a thorough revision note and an exam-style cheat sheet for this revision topic. If you did find this video useful, please make sure to like, comment and subscribe. As always, until the next video, take care.